Hello, another day at the Volunteers in Medicine in Chattanooga Clinic. And who am I here with?
Melinda Craft.
Of course, I know that. For the folks who are tuning in to watch us don't know and learn more, Melinda joined, has it been 9 months?
I guess about that. It was in August, middle of August when I started.
Wonderful. So she joined the Volunteers in Medicine family here, and the role we're going to talk about a little bit and some of the wonderful things that she's already had early success with. But I think it's kind of good for human interest. I had the pleasure of actually knowing Melinda. We worked closely together for American Cancer Society, where she was the staff partner and I was her volunteer. So it's amazing when Chattanooga and our world gets smaller. But one thing I recognized very early on, she has a huge heart. And with much prayer, I feel Melinda was led to us for this interesting journey that we've already begun together. So tell a little bit as far as what do you do here for the ministry?
I am active in reaching out to our referring partners and our collaborators in the community. So I'm, really getting to know and reconnect with some folks that maybe through COVID or from, changes in staffing in different places, we kind of, stretched our ties with. So now we're kind of getting back together, so to speak, and talking about, people that they know that can utilize VIM services and how we can help people that they need to find resources for.
That's wonderful. So when you're out in the community and you're representing Volunteers in Medicine, you're talking with local churches?
Yes, a lot of the mission committees and pastors that are very engaged in outreach at their church and how to best serve both the people that visit their churches and their congregation and help connect members in their congregation to area volunteer work.
Sure. I think it's important for folks who may not be as familiar with our story. Volunteers in Medicine birthed out of the need when churches gathered as a group. You can imagine when you go to your church, and hopefully folks have a home church. If you're not, when you go to the church, you're looking to either be fed, either spiritually, holistically, or you might have needs such as health and you're in crisis. I know we've been out together and we've actually literally seen an individual on the other side. We're waiting to check in to go and talk with a church group, and the individual's on a phone and they're saying, help. And this is, fortunately, Volunteers in Medicine, we're a resource. So besides those churches, I think you're also been trying to connect with our hospitals.
Absolutely, with our emergency room, physicians, nurses, caseworkers that have an occasion to, see somebody in the emergency room and realize that they need follow-up care with a primary care facility.
Sure.
So that's been a journey too. And like I said, there are so many people in the healthcare field that are seeing patients at different times. It's really necessary to make a lot of connections so that people know about us.
And we've talked about it. It's been kind of interesting and also an anomaly when as we come and emerge through the pandemic. And our hospital partners, we've seen such turnover from case management to staffing. Always that continues to be a stress point for them as partners, but us trying to remind them we're here. Our doors have never closed. And there's been some surprise for some of the folks, but just those kind of conversations you're having.
Exactly. And finding, people who are new to their roles, not knowing about VIM. So, introducing new people to VIM every day. I really get excited about that because telling the VIM story of how it came to be and how collaboration and faith are really a foundation for us here.
Wonderful. And I alluded earlier about with your church conversations, so many churches also with their missions and their outreach is with food assistance. You want to talk a little bit about that as well with some of those conversations and connectivity?
Oh, how we're working in tandem with some of the food pantries in the area and getting the VIM flyers into bags that are actually going home with people who are getting food, and then other areas of help too are the volunteers opportunity for them to also participate with us as a volunteer location.
Absolutely. And we talked about in the last discussion we had with Peyton on the Patient Resource Navigation Program. And you see, hopefully, if you had a chance to see that interview and then hearing Melinda, how those programs work very much in tandem, but also apart at times, from hearing the heartbeat and then being out in the community and then keeping that based on some of this unmet needs like we discussed with food pantry, food insecurities, and where that kind of goes as well. Anything else you want to share? I love your passion, your dedication, commitment for Volunteers in Medicine and our health mission.
I would just say if you're watching this and you are learning about an opportunity or think this is something that you'd like to share with a small group or a large group that you're in, let us know. I'll be happy to come and speak and share the VIM story at your location.
That's wonderful. And there's so many opportunities, as Melinda was sharing, to be a volunteer, to be an ambassador. Our small but mighty staff work with over 100 volunteers. We're open to having more and helping that grow. There's so many opportunities. Yes, we treasure and cherish our medical providers who provide the direct care for 100% free to our patients once they meet the criteria. Some people are like, don't realize that, that can't be the case. Yes, our patients, if you meet our eligibility, working, low income, uninsured, you will never receive a bill for your care here, and also get essential prescription assistance. But where I was going with that is also opportunities to help be an ambassador, be a volunteer for your church, for your school. Think of all the things in your daily life. We've got a group right now, some students, and what they're doing is they're out putting out flyers. So getting that word out to folks about that we exist and how we can further help more. Neighbors helping neighbors in need. So once again, thank you for this time. We'll continue these conversations, mixing with both staff. We'll have some more conversations with volunteers as well. So thank you and have a blessed day.